one last question on this before we move into the next segment and discuss issues like the budget and all that. Now, if I compare, and I had this thought when during the whole crisis, not crisis, but the protests were being done by doctors on the contract issue and all that, and all that things. If I'm an engineer, say I have an IR title, I am allowed to sign and drawings and all that, right? Now, if that project, that building or that whatever bridge or whatever collapses or there's an issue that has caused casualties, I am legally responsible. Right? So that's why an IR signature is very looked. I mean, I could be wrong, but it is very much sought after. When it comes to doctors, do you think that there is almost no oversight on the consequences of your work? Because I have been in functions where it's only doctors, okay? And I've heard doctors tell me, okay, that sometimes they recommend surgeries without even needing it. They put in stents when you don't need a stent. There are doctors who do this, right? And this is allegedly. I must be careful. And when a person dies under the care of a doctor, it is oftentimes taken as that's just life. Okay? Do you think that more oversight or more burden of proof should be placed on doctors to ensure that healthcare, the outcome in terms of the healthcare is better?
I think absolutely.
Okay.
I think, of course, there is issues like negligence. Some people are brought to court for trial. Some are subjected to medical counsel, whether they still hold their practicing license and stuff, specialists and stuff. So oversight exists. The issue is costs to prosecute, costs to pursue a charge and stuff. So when that happens, let's just say there's a mismanaged situation in a government facility. Okay, yes, the government has the DPP and stuff, but for you to get a competent lawyer to go in pursuit for that negligence, it's going to cost you 30,000, 50,000 ringgit. And then if you're talking about the B40 community, that's not going to happen. And even if you're looking for like pro bono lawyers out there, how many are there who's willing to come and help you? Unless it's such a big case and it's like they also want to take center stage, then it's a different situation. So that's one thing. And then when it comes to private practice, it's also the same thing. So if you want to sue for negligence, yes, and you need to find practitioners who are willing to take on their peers, one, as an expert witness. You need to find a very competent lawyer who knows some sort of maybe a medical, very significant medical understanding and background to pursue the case. Extracting documents from the hospital in hope that the documents stayed intact, not manipulated. So there's a lot of these things which I was very lucky when I served in the Ministry of Health. Under my department, this is the things that we have to look at for the perspective of the public. Handling private healthcare, but I was looking also at one segment of my task was to look into the grievance mechanism, whether the mitigation or the discussion between the client and the service provider was right or not. If they were still not satisfied with whatever explanation were given, then our option is to look, if you feel that you didn't get what you deserve, then you proceed for legal action. So yes, this what I define as this cover backside medicine is going on. I've
never heard that term, cover.
It's going on where there is a scenario where I call like they are more interested in the medical card than you.
Ah, yes, that's true.
Okay.
That's true. Yeah,
so you walk in with the card, okay, this card you can claim 100,000 ringgit. Okay, I'm going to call all the vultures to come in. Who wants to be referred to this? But that's the problem today when we see that the rising cost of healthcare also, because there's no check and balance. For example, if I were to say, okay, Vinod, you got this thing. I think I can find some problem with you, or we can fix this. You want me to refer? I'll refer you to this guy. I'll refer you to this guy. So there's 10 guys coming in for one case to look at. But one guy can actually manage it. For example, like if I go to when I was an MO in government itself, in the orthopedic department, you will realize that sugar is high lah. Orthopedics don't want to handle. We have all been trained. Okay, we'll up the insulin. No. We will refer to medical to come. So the medical MO must come to this department, review. Okay lah, increase the thing. Just because I just don't want to sabo, or I just want to get involved in handling sugar. So I'm only going to see the bones. I'm only going to plan the fracture and plan to put the implant. This is what happens. So then I'm going to say, like, I'm going to refer to my specialist internal medicine guy to check your sugar. What do you say? Okay. Then comes. And then the guy comes in and say, like, I think we need to start you with another insulin. We need to start. So this is what happens. So that's why the bill goes up. Because like something simple, you know what? I'll refer lah. So there comes 270 ringgit. And then that guy will come tomorrow and say, how's your insulin? Okay, another charge. Afternoon, I'll come and check again your insulin. Come again, charge again. So that's why the bill goes. And also another thing you must understand is, all of these specialists, unfortunately, if you're watching out there, we know this, they report to a CEO who is maybe not even a doctor.
Yeah, definitely.
So what happens in that situation is like, Dr. Vinod, how come your sales this month only 300,000? You expected to maybe make 500 to keep your seat.
My goodness.
And it's like, no, I'm this good doctor. I don't want to prescribe medication, and I'm not deciding these people to go for surgery and everything. You lose your seat in the hospital.
So the system is rigged to incentivize charging patients.
I mean, it is for profit.
Yeah, but there must. But I you know what? I must be honest. When I got into healthcare, and I started meeting a lot of doctors and hospitals, oh my God, the healthcare industry is just. I said no, I don't, because I started saying things that I was like, why am I saying things like this? Like, you know, when you want to bring down certain equipment, and then you're like, no, but it's not profitable. Then I'm thinking, but there are still a group of people who need this equipment, although it's a small group, but they still need it. And I started saying things like that because, you know, you think about the profit, and I said, no, I can't do this.
No, because that is how the industry is designed. So like, if the only way to sort of fixing this problem
nationalizing
is no, that's it can be done, but there's going to be random audits. In order to check and balance, there has to be people who are competent to go in and do audits and see whether the practice is right. Because there are a lot of hanky-panky that goes on. For example, if you come in and say, like, look, I want to plan for a bilateral tubal ligation. I mean, for someone who wants to snip her fallopian tubes.
Oh, okay.
Yes, I've got 4 kids. I'm done, doctor. Then the doctor will say, like, you're going to pay yourself, or you want me to use the insurance? Then he say, can you use my insurance? Can. I'll just put like you got a cyst there in the ovary. Who saw the cyst? How to justify? I don't even need to do a scan to show the insurance company that I proved that there was a cyst.
Not even a scan.
Why not? Why should I? I'm a competent physician. I can do it. So I can go in, do the table ligation, and then claim I have a cyst. So, and then this young woman who's maybe 35 or 36 years already had 4 kids said, I insist I wanted that. 8 years down the line, really has a situation somewhere maybe in another state, had to go for a massive surgery and say, like, oh, there's a cyst again. Open insurance, cyst was done, removed last time. How come the same place? That's where the problem comes later. Like, whoa, query back why this thing was already removed but not told, or something happened. These kind of things happen. So, like I said, only through a national auditing system where everybody can be placed in line. So, whether in government or in private, if you are able to audit the hanky-pankies with a proper system, or maybe like a task force or Suruhanjaya or Jawatan Kuasa kind of thing, then everybody will be standing in line. They cannot do this Kind of.